Hello, good day. Welcome back to yet another episode of Beyond the Stethoscope, where we discuss with medical practitioners not only about hospital setting or diseases, but mostly about personal and professional life. And today we are together with another vibrant medical practitioner, a medical doctor. Doctor, please.
Okay, good day everyone. My name is Dr. Muhammad Jaafar. Thank you for having me in this episode of Beyond the Stethoscope.
Thank you, doctor. So let's start by asking, doctor, what draws you to MBBS to becoming a medical doctor?
So actually, um, it was an ambition of my father and my late uncle. So it was the first point of having the ambition. My father wants it, and my uncle to try his all possible ways to see I became a medical doctor. Unfortunately, he died.
So,
Okay, of course.
so it is clear that partly it is not entirely your ambition.
Yes.
So if you have a chance to start over, will you still go for MBBS?
Actually, I will still go work for MBS. I still go work for MBS. I like it, so there is no any concern about it.
What was your hardest course during your MBBS years?
Okay, I think this question is the same for everyone. I think for every medical student, when you are in the clinicals, it was biochemistry, biochemistry. So when we came to clinicals, it was pharmacology.
And do you think the medical school curriculum has adequately prepared you for real world practice in the hospital setting?
So virtually, I can say yes because we are humans, so we can be 100% perfect. So actually, our school duty have tried. So they prepare us for the current situation of the medical practice. Actually, they tried yes, yeah, they tried.
Beautiful. If, for example, you have the capacity to add one course in the medical school curriculum, be it, for example, ethics, guidance and counseling, uh, you understand, taking consent, for example, finance, law, whatever, which course will you add?
So in medical school, is it in the clinicals or in clinical?
Anywhere you like.
Anywhere.
Mm.
So so I will add guidance and counseling. I will add guidance and counseling because we like it. But for the others, we have it during our clinical school. We are having it the ethics, the finance, the law. We are having some courses that are related to them. But for the guidance and counseling, it's only during the mentor and mentee session where we have a little session for professors and consultants, and it's not for the whole 3 years. It's just for a short period of time. So I would recommend guidance and counseling.
I understand. What is one thing medical practice has forced you to learn that you have not learned it during medical school?
Okay, actually, it is ENT clinical stuff. Yeah, yes, and thoughts. It is after when we start the house job and practicing daily medicine that I saw, oh, I miss it. Because during the fasting period, we didn't learn much because we thought it is only after you came for residency then you have to
Specialized.
specialize on it. But when you came out, you see patient, and patient doesn't know whether you are ENT or they know you are you know you as a doctor, you know everything. So actually, I miss that. stuff in ENT, but Alhamdulillah, I'm catching up now.
So, what is one case of a patient you think you can never forget?
Okay, like I can never forget. Actually, I have them a lot. Yeah, I mean, so but the recent one is the case of one patient that came with diabetic acidosis, and unfortunately he died after he started improving. So we thought it is from he just threw an embolite, so an embolite. So it is
So, what is the unique situation in that case that stick to your mind?
the sudden death. Sudden death. Suddenly we place him on in insulin infusion, and when he is moving, his random blood sugar is developing beautifully, and then just within a short period of time, he start gasping, and then within just minutes, he passed.
And that is sorry, that's unfortunate. Doctor, have you ever had an encounter with patient in a situation where you will have to break bad news to them? For example, a death, or somebody can never has to get an amputation. You understand? Have you ever been in that situation that you break the bad news and that situation has been haunting you?
Actually, uh, for this question, I didn't encounter any such kind of things because whenever I break bad news or give a patient some news that is not comfortable for him, it didn't haunt me because I already prepared my mind that I'm trying to help the patient.
And you are doing the right thing.
Right, so I didn't feel anything.
And you go in a way that you support him psychologically so that
Exactly.
he will find it a bit more bearable.
Exactly.
I understand. So, doctor, what is one thing that you have not learned in school that medical practice has forced you to learn?
Okay, is the tolerance of the patient's attitude.
Mm. Okay, can you elaborate a little? For example, you might have a patient that.
Yes, what I mean here is when you have a lot of patients and they don't know how the triage system is,
Yes.
especially if you are in a clinic
Yes.
where you have a lot of patients. Some are having emergency cases, some are just relatively stable. So they thought the
First
come
serve.
first serve. Yes, you don't know that thing. So that, and then you'll come and start saying,
Shouting,
Doctor, yes,
I come
Doctor, I
first.
came first, and you didn't see me. And everyone will come and say his own thing. So you have to come down and tolerate their own things.
So, doctor, let's say there is somebody who has just finished secondary school and he is seeking for MBBS admission, or maybe he has been enrolled for MBBS. What advice will you give this person?
So the advice that I'll give him is um, don't rely on MBS alone. Try to have side hustle. Try to have another business. Try to have another source of income. And then don't take medicine as a what do I say? It's a alpha and omega for your life. You have other personal life to live and other things to do.
I understand. But then, don't you think, let's say, that business will distract him from studies?
Actually, no, because during my medical school life, I'm a farmer
Wow.
and a tailor,
Wow.
and I have some like rams that I'm rearing,
Yeah.
and I'm even into poultry um, farming. So it depends on how you manage your time and the kind of people that you are having the business with them. Just try to have the trusted friends and then manage your time properly. That's all.
I understand. So, doctor, you said you are a businessman. You are a medical doctor. and definitely a family man. So even the medical practice is so demanding. How do you manage to take care of all of this without being burnt out? And if there is burnout, how do you manage to reset? What are your hobbies for that?
So definitely, when you are a medical doctor, a family man, a businessman, you may have burnout, and you can't deny it. Can't deny it because things are overwhelming. The work stress, the family, business. So uh, I used to have burnout. Sorry, I'm having it. I'm not. I mean, I'm having it. So whenever I have a burnout, the things that I do is just I would have a drink. I would just initiate a journey. Just initiate and alone without anybody. I would just initiate a journey, and then I go and refresh myself.
So you will have a journey to somewhere
Yes,
and stay,
exactly.
then you come back.
Yes,
Okay,
yes.
what do you do there mostly?
Actually, I just ventilate all my stress.
Okay, you eat, you drink, you sleep, you come back.
Yes, but I speak a lot.
Okay.
I ventilate everything.
Okay.
I ventilate everything. I will have a quiet place and talk to
To
myself.
yourself.
Yes,
Wow.
and said everything that is worrying me. I said it alone. Then I will come back.
Beautiful. This is a good one. So, doctor, what is one thing or two when you are outside hospital setting that makes you remember hospital instantly?
Okay, thank you for this question. Actually, whenever I step out my desk from the hospital, I forgot that I'm a doctor. So the thing that reminds me of the hospital is the odor of the medications, and then
Order of medication.
odor of medication, and then when unfortunately I met a place where I suffered traffic accident. So
So, the title doctor to you, is it does it give you more sense of pride or more sense of burden?
actually, it's a burden. There's no pride in becoming a doctor. You just have to humble yourself and take the responsibility. Because for anything that you have as something title, people are putting you, you have to pay the price. You have to pay the price for it. So to me, it's a burden, not something to show up.
Doctor, I describe the feeling for us after receiving your admission letter for MBBS. Was it a relief, a time for joy, or a panic?
Actually, when I received that I got admission, I feel happy, but not that much. Because at that time, I was not that serious about to enter medical school. The passion and ambition is just for my father and my uncle. It's not on my own. Then after when I started the medical school, then I started feeling the joy. But initially, I'm just uh, indifferent.
And what makes you accept the MBBS to study the MBBS?
So, you know, our own tradition and culture, we are obedient and loyal to our parents. That's all.
So, doctor, what is one misconception you had about doctors that now you have become a doctor and realize, okay, what I was thinking was wrong?
Is it regarding the patient or regarding the medicine itself or regarding the
Both.
doctors?
But
A lot of this
okay, give us a
misconception.
few.
So for the patient, initially when patient came and he's having trauma in his backbone and they said he's having spinal cord injury, initially I thought the entire vertebral column is the spinal cord. After when we start studying it, then I get the difference between vertebral bone and the spinal cord. So that's the first thing. Then second thing, a patient with psychiatric issue. Initially, we thought every psychiatric issue to me, uh, the spiritual part, that's the gene part actually is not part of medical. Then after we dig deep into the medicine, then I guess that there is conversion disorder, which patient gets like he's having gene. And then some electrolyte imbalance may give the symptoms. So these are all
Even
the
severe malaria.
exactly. So there are a lot of disorder. And then also regarding the medical person, I thought they are sent. They don't commit some things that we are seeing now. So it's not everybody that is good. So some of us see what I realize is the habit and the action of a person is own habit. So it depends on how you manage yourself. So being a doctor doesn't mean that you are a saint and you cannot make a mistake. And then our own habit and action toward medication and seeking care. You see a doctor smoking cigarette and a doctor taking alcohol. So till after when I joined the practice, then I saw a lot of doctors consuming alcohol, taking cigarette, engaging in other things that are not good.
At what time do you feel, yes, I am a medical doctor?
So after I started a household and I have a patient that had cervical tear, that had chronic uh, vaccine hemorrhage secondary to cervical, and I'm the one who to repair it. So at that time, then I realized that yes, and it was in the night around 3:40 something. So the SR was not around because I didn't reach him to phone and him also ringing. So I'm the only one. So I have to take the boat to repair it. And alhamdulillah, successfully I repaired it. In the morning when I talked to Dr. Habib, when we came for morning review, and I told him that we have a patient with cervical tear and I'm the one who repaired. He said, you have did wonderfully. Just go and sit down. No any morning
Review for you.
So that's the point. Yes, I'm a doctor.
That is so beautiful. Okay, so what is one disease? What is one disease you think people or the general population should know more about it?
It's a difficult question. One disease people should know more. One disease.
Let's say two diseases. Why?
You see, we in developing countries are battling with communicable and non-communicable diseases. So for non-communicable, hypertension, and diabetes mellitus is two. And for the communicable ones, so let's say UTI, urinary infection, and then typhoid urea evacuation.
For example, why do you think people should know more about these diseases?
For the hypertension, because of its complications and the natural history of the disease, the way it progresses, it is a silent killer. It will be there with you for many years and it will not give you any sign until it start giving you complication. Then you come to hospital with the complication. Has it been initially when the person is going for regular medical checkup? It will have been diagnosed and then proper management will be instituted. Also, diabetes mellitus. Though it may give a person signs, but we ignore signs because of our healthcare seeking behavior and financial
Negligence
constraint.
and
Yes,
personal negligence.
exactly. So, and their mobility and mortality is high, and they can lead to other systemic diseases. So, if the population will know these two, it will okay. And for the UTI, also because of its prevalence and the most uh, commonly affected individuals are the women and the children, and they are the largely population that they are having. And also for the typhoid population, because of the management and the complication that may arise following surgical intervention. So, and always they are, what will I say, they are preventable diseases. We can prevent them, and we can prevent their own complication.
Now, an increased development of technology, AI, telemedicine, and
Yes,
all that.
yes.
What will you say about that?
They are very helpful. They're very helpful. And I too, during my medical school, I did my project on robotic surgery. So I I read more about it and I saw it is helpful, and I encourage medical practitioners to go into it and use them, but use them um, wisely. Wisely.
Doctor, who is one or two person among the pioneers of medicine would you like to meet if you are given the chance?
Okay, for this question, if I will have given a chance, I would choose two persons. One is this person that is called the first person that did medicine in Nigeria, Baru Barudiko. Barudiko is the first northern right that did medicine. So I would like to have met him. Then now I'd like to continue meeting with Prof. Musa Barodo.
And why these people?
So for the Barodiko, because of his own challenge and the way he studied medicine, they are the pioneers. I just want to encounter him and ask him how uh, they did the medicine, because the teachers are not Nigerians and they are not Hausa people. So how they cope with the schedule. And for the for Musa Barodo, his own dedication and way he is helping student and education at large. And also like his own religious attitude. He is truly religious and is serious about the medicine.
So, doctor, how do you communicate, uh, convince, and even try to build trust with patient or patient relative who are skeptical about modern medicine?
Okay, the way I convince him is by being honest with them and then explain the whole thing to them. So whenever you are honest to a person and he sees sincerity in you and honesty, and he saw you are not joking, you are playing and this is serious, that's how I did my things.
Okay, that is very good one. Okay, have you ever encountered a difficult patient who has Google or used AI to see his diagnosis now come to you for consultation, and how did you handle the situation?
Okay, I only met one patient with this kind of scenario. So after we met, so I explained to him again, and I said, you shouldn't be doing this. This is our own setting, and this is how we are doing our things. You shouldn't be googling. You may be misled. And then even we that doctors, even if we read something in a book, sometimes we use our own local management and local settings, things that work for us. So it's not every management that you see, it will be for you. And patients are different. Even if you have many patients with the same condition, the treatment option for every patient is individualized. So you couldn't say that whatever you do for patient A, you will do for patient B. So that's how I go about it.
And especially geographical location matters, gender, race, and all that. Even height sometimes matters in terms of prescription. Okay, so what are the qualities you think are most important in clinician, in medical doctors or health providers?
Most important ones are first to be trustworthy, honest, and then to be dedicated to your own work.
Understand. If there is one thing you want to tell to general population, an advice, what would it okay, if there is one advice you want to give to general population about health, what will it be?
Is to correct our healthcare seeking behavior. Whenever we have any symptoms, whenever we have it, at the first time we should come to hospital. Don't go to chemist. We should just come to hospital and then meet a doctor. That's all.
We are actually concluding. So, Doctor, what would you say about Nigerian healthcare system?
This is obvious for everyone. The Nigerian healthcare system, uh, I can say there is an improvement because we are easily adapting with the advancement. And the main challenge is the budgeting and funding from the government. Government is not funding well, it's not budgeting well to the healthcare system. But we are easily adapting and we are accepting the advancement and the technologies. And we are seeing the outcome. And because of the mortality is reducing, and then the complication of some disease now they are reducing, and also diseases that not been treated before now they are treated, and some and other management that were not in Nigeria now they are here like kidney transplant now it's being in Nigeria, and other surgical interventions, and the number of the doctors now is also increasing. So there is improvement on the other hand, and there is also lack of seriousness from the government.
On the other hand,
Yeah, on the other hand.
Japan or staying in Nigeria?
I will say in Nigeria because I'm doing my own business. So I will say in Nigeria.
Do you prefer ward round or clinics?
I enjoy both, but I enjoy clinic most.
That's it.
Clinic. Because I sit. Because I don't like for long standings. If what one is just short, what one it should be okay. But for long, long standing what ones, I didn't like it. But when I'm sitting, I can stay up to 3 hours, 4 hours. More than that, the clinic.
So when you are on call, which one do you like the most? Tea, coffee, or carbonated drink?
I enjoy tea. Enjoy tea.
That's it. Thank you so much
Okay, so
we are happy we have you.